Howdy, my name's RJ Andrews. I am a data storyteller and I am editor of Florence Nightingale, Mortality and Health Diagrams. So Florence Nightingale is famous, deservedly so, for many, many reasons. But the particular reason or aspect of her life that attracted me to her story is her career as a statistician. And as a statistician, Florence Nightingale did some really spectacular things. And particularly, she worked with persuasive statistics, how to use statistics, how to use data, not just for analysis, but how to use numbers to persuade people. So we think of Florence Nightingale as a nurse, but in reality, at war, she worked not just as a nurse, but as a nursing administrator. And as a nursing administrator, she is not only overseeing a battalion of nurses, she's overseeing their supplies, she's doing a lot of administrative tasks. And in those administrative tasks, she's recording and managing all of her duties with data, particularly data tables. And there are some data tables that have survived from Nightingale's war service. Now, after the war, Nightingale did some really spectacular work with mortality data, with sickness data, data about what soldiers were getting sick, what soldiers were dying, how were they dying. But sometimes we confuse the data that Nightingale produced while at war and the data that Nightingale used after the war. In fact, it's not the same data. Most of the mortality data from the war that Nightingale used after the war was produced by other people. So you can think of data, wartime data, as coming from a lot of different places. Nightingale once described the conflicting sources of data. So imagine a soldier gets sick on the front lines. He's boarded onto a sick ship. He goes across the Black Sea on a multi-day journey. He arrives to Nightingale's hospital, is admitted, falls further ill, dies, and is finally buried. Now, along that story, there are several points where that soldier's life is captured. It's captured by the officer, it's captured by the ferryman, it's captured by the medical officer who receives him to the hospital, and eventually it's captured by the adjutant who actually buries the soldier's body. Now, the problem is that none of those data sources matched one another. And Nightingale was aware of this, not only after the war, but even during the war. She recognized that the data quality was a big problem. So there's many different places that data is coming from. Ultimately, Nightingale relied on 6 different sources after the war as she assembled her own data sets for analysis. When Florence Nightingale arrived to the hospitals at Scutari, she really arrived to a scene that was, I mean, there's no way to say it, is hell on earth. It is absolutely disgusting. So we have soldiers packed in with only 18 inches between them. There are amputations being done in the open without screens. They're not moving them to an operating theater. They're just doing the amputations right there. Most soldiers are dying who are being amputated. There's one bedpan being shared between every 40 soldiers who have dysentery. Soldiers are arriving from the battlefields in waves and waves and waves. Everything is covered in vermin. Nothing is clean. Soldiers don't have enough clothing. They don't have enough food. It is bitterly cold. There are not enough medical staff. It is just absolutely, absolutely horrible. You have human filth, insects, vermin. You have rats. You have rotting animal corpses. You have bad water, putrid air, blood, and human feces, flowing all over the floor. It's just an absolute disaster. As soon as Nightingale arrived to the hospital, she set to work. She took several measures to improve the hygiene of the individual soldiers. And so she set up a wash house to try to give their clothing a hot wash and rid them of vermin. And she went out on her own with her own funding to collect different supplies for the hospital. She also had an analytic mind, and because she had an analytic mind, she set to work doing things like putting numbers on all the beds with a piece of chalk. And so there are several examples from early on where Nightingale sets to work to organize and improve the hospital environment. After Nightingale's first winter at war, a politically motivated set of commissions, groups of experts showed up to the war theater to help improve things. And so there was a supplies commission and there was a sanitary commission. And these commissions were not created by Nightingale, but they were welcomed by her, and she befriended all of the people who worked on these commissions. And the sanitary commission, in particular, helped improve the building's hygiene, where Nightingale had formerly helped improve the patient's hygiene. So the first year of the war was really devastating to the British Army. Effectively, the army was lost, and army, little a army. And Great Britain had to send a second army, again, a little a army, to replace all the soldiers who had been lost. And they hadn't been lost to bullets. No, no, no. These soldiers were lost to cholera, to diarrhea, dysentery. That's what the British Expeditionary Force fell to. So Nightingale had her own budget, her own funding that was raised by the public in London, and she was able to use some of this funding to go out and purchase supplies in Istanbul on her own. And supplies were incredibly important to the war effort. Supplies include not only clothing, but also tools, also pop-up huts, living enclosures, and also all the food that the soldiers would eat. And the supply situation was just as detrimental, if not more so, to the condition of the British Army as all of the public health inadequacies. The second year of the war was dramatically better for the health of the British soldier than the first year. And the big question was, why? What had improved? And in fact, there are many, many reasons why things improved. Well, maybe the weather got better. Maybe the sanitary commission's work did a good job at improving the hygiene of the hospital buildings. And maybe it was, in fact, the increase in supplies and improved quality of supplies that helped the British soldiers' initial health on the front lines. And so it was many, many reasons why the second year of the war was so much easier for the British soldier. The British soldier had great affection for Florence Nightingale, and the feeling was mutual. She carried a great deal of respect for the individual soldier, and it's a respect that their officers did not necessarily always share. She saw the soldiers as independent, free-thinking men who needed just opportunity to do good. And so Nightingale worked very hard to give them some of the opportunity to enrich themselves and live what she thought would be, good Christian lives. There was a real danger immediately after the war that all of the problems of the war would be repeated, and none of the solutions that were found at the war would be duplicated. And so Nightingale and a circle of allies, who I call the reformers, all worked together for several years following the end of the war to make sure that the reforms implemented during the war would carry on, would be institutionalized, and that the bureaucracy of the British Army and the British government would not repeat its mistakes. I call them the reformers, and they include medical doctors, scientists, statisticians, and political allies. The two allies that I believe are most important to her work with statistics are first William Farr and second Sidney Herbert. William Farr was England's top statistical talent, and it's really with Farr that Nightingale's statistical aptitude soared. Farr was the lead statistician at the General Register Office, which was responsible for cataloging all of Britain's births, marriages, and deaths. Across the preceding couple decades, Farr had created an enormous wave of high quality data. And this public data of what was happening in Britain at the most basic level: who was born, where were they born, who was being married, who died, and how did they die, which was very important, created an enormously successful data set of what was happening in Great Britain. And it was a meeting between Nightingale and Farr where he showed her all of this high quality data that Nightingale became inspired. And she saw there several opportunities. One, it reinforced her intuition that the British Army data needed to be collected with much more rigorous quality standards. Two, she had an idea when she saw Farr's public health data. And that idea was that she should compare the Army mortality data to the civilian mortality data. And by making that comparison, she would be able to highlight how absolutely horrific the conditions of the British Army actually were. Seeing William Farr's public data about civilian mortality inspired Nightingale to make a persuasive comparison that would highlight how dreadful the Army mortality situation was. And she would make this comparison between Army mortality and civilian mortality. But she wouldn't compare Army mortality while at war, because that would not be a fair comparison. Of course, it would be more dangerous to go to war. What she did is she compared Army mortality of soldiers who were stationed at home in barracks just outside London, compared to men, civilian men of similar ages. This is a very fair comparison. In fact, it's a comparison that favored the Army because only healthy people were admitted to the Army. There were many unhealthy people who would not be allowed to serve. Sidney Herbert was a prominent British statesman, friend, and ally of Nightingale. He, in fact, was responsible originally for helping send Nightingale to war. Now, Herbert and Nightingale's relationship only deepened after the war, and Herbert was essential to helping Nightingale have her messages actually be seen and actually be read. Because it's not enough, especially when you're waging public discourse, to have the right answer. Having the right answer is, in fact, only the beginning. Once you have the right answer, you have to get that right answer seen. You have to have that right answer be understood and be adopted by all kinds of political adversaries. And Herbert was the one who helped Nightingale do all of that. You can think of Farr as helping craft the message with Nightingale, and then Herbert is the one who helped that message be heard. Farr, Herbert, and Nightingale worked together to create various types of content. Now, the content was sometimes a speech, sometimes it was a folio, sometimes it was text, sometimes it was diagrams, sometimes it was an official government publication, sometimes it was a secret print that wasn't published at all. There was, in fact, a war happening in printed matter between Nightingale, her allies, and their adversaries. Now, the adversaries used text and statistical diagrams, just like Nightingale and her circle used text and also statistical diagrams. Now, when we look across Nightingale's publications, what we'll see is that she integrated prose, which was often very, very witty, statistical tables, and also beautiful, colorful statistical diagrams, what we today would call data visualization and what they called diagrams. And these three elements, the text, the tables, and the diagrams, were integrated. All three referred back to each other. And so there was a multi-dimensional experience of reading their publications. Now, these were very successful, and they're very successful from a variety of perspectives. But the most easy one to understand is that both houses of parliament received their publications, and they both approved measures to improve overcrowding inside army barracks. And that was the earliest, sort of official win for the reformers. The stakes for getting the lessons right coming out of the Crimean War were really high for the British Army, because what was on the horizon was India. For the next decade, Nightingale would help the British Army by continuing similar analysis and also creating similar statistical diagrams, helping understand the public health situation in India. And then in the following decade, now we're into the 1870s, we would go back to Britain's civilian health with Nightingale and her allies helping to implement the Public Health Act of 1875. Florence Nightingale's work as a statistician really inspires me. And what she teaches me is that it's not enough to have the right answer. You need to have the right answer, and then you need to beat everybody over the head with it over and over and over for years and years and years. And that's, for better or worse, how progress happens. It takes a lot of struggle. It takes a lot of time, but it does happen. And because Nightingale fought for progress for so many decades, she is credited with saving millions, if not a billion lives. My book about Florence Nightingale's persuasive diagrams, Florence Nightingale mortality and health diagrams, has this very, very sort of flashy, modern partial jacket. But then you pull it back and you reveal first, one of my favorite quotes from her: "Whenever I'm frustrated, I revenge myself with a new diagram." And then you pull all the way back and you can see one of her famous diagrams. And this is really a metaphor for the book, because the book is a very modern, clean, beautifully designed look at her work. And the idea is to not only explain her work and elevate her work, but help us understand not only what she did, but why she did it.